at Discover Specific Chiropractic on Hilton Head Island with Dr. Ken and one of his patients, Andrea, who actually lives in Chicago but comes here for treatment, and her mother, Danielle, who lives on Hilton Head. And you've been working with the neuropathy patients for like 2 years, and it's been quite successful. A lot of need, right?
Yes,
a lot of need.
Yes.
A lot of people don't realize that there is help for neuropathy.
Exactly. Yeah.
And so let's talk with Andrea. And Andrea, nice to see you and meet you.
Yeah.
You were having an eye disease issue that then caused your neuropathy. Kind of quickly tell us about that.
Yeah, I mean, just briefly, I have a retina disease, and as part of treatment, I was on a chemotherapeutic agent, and it was within like 24 hours of being on the medication that I couldn't feel my feet anymore. And so that was 7 years ago now.
Wow. And how did you feel about that, Danielle, when she first started, not only having the retina disease, but also the neuropathy?
It was heartbreaking. Yeah.
And so you had been a patient of Dr. Ken's, and you saw the sign in the lobby.
Yeah, no, I heard Dr. Ken's wife on the phone talking to someone about the process, and I was just, yes, we have to do this. My daughter, we have to do this. And I asked Dr. Ken if she would be a candidate, and he said, well, let's find out. So she flew up. I told Andrea, and she was a little less.
You were doubtful.
Excited.
Why were you so doubtful?
I was doubtful because, well, I think at the heart of it, I just didn't want to hope for something that wasn't possible. I had started to accept my neuropathy. I had accepted my blindness, but it was just hard to hope. And I'm also in like the medical system. I'm a dietitian, and so I feel like very connected to like evidence-based treatments. And I just was told time and time again that there's nothing to do for neuropathy. There's nothing to do.
And so what did you do for Andrea when you first met her?
We treated her lower back, and we got the blood back in the feet.
And how do you do that? What is some of the...
We figure out where the blood goes to, and then we do a very thorough exam, and we check all the feet and see what things do work and what things don't work, and we figure out exactly what we need to do for each patient.
Right.
So for her, which was so heartbreaking when she came in, she said, one thing is to be blind, but worse is to also lose your balance. So she had no balance at all. She couldn't stand on one leg or the other. Oh, it was very, very sad.
Did you have your dog?
Yes.
You see my dog?
And luckily, I have a guide dog who's a big dog, so he was also a sturdy, he helped with my balance.
He helped with your balance as well.
But it's nice to not just need him for balance anymore.
Yeah.
So you had to also do a lot of, I guess it was intense in the beginning, a couple of weeks.
Yeah.
And then what?
She was sent home and doing all the homework.
Right.
And then she came back. And how long did it take to get your balance back?
I mean, it was 4 months.
4 months.
Yeah.
Which was awesome.
So
after having it for 7 years.
I know.
With balance, it's really
so
awesome.
it's like, I want to use the term miracle. But
It is. It's amazing.
It really is.
Yeah.
But if you know what to do and you know a doctor that knows what he's doing and is studied in this, it's so important to find someone that does know what they're doing, like Dr. Ken.
And we just checked her again today. First day she couldn't feel vibration. She can now feel vibration. First day she couldn't feel, like we check, see how much they can feel electricity or anything. She couldn't feel electricity. She could now feel electricity.
Wow.
So it's fun. She can so we're cold and hot and all these things couldn't feel the first day, but now can feel. It's exciting. She's practically normal. I mean, she has a normal. It's the same in her hands and the feet. The vibration. She feels no difference.
So do you have anything you want to say
Isn't
to
that
Dr.
awesome?
Ken?
I mean, it's just amazing.
You mean like thank you?
No, yeah, it's great, isn't it? I mean, it's great to get to feel that. It's so awesome to see it.
And Danielle,
Oh, I'm so grateful.
Yeah.
Yes, we are
It's
very
exciting.
grateful.
Well, thank you so much for sharing your story, Andrea, and
my
Danielle,
pleasure.
for being with us in the interview. And Dr. Ken, great work.
Thank you. It's
Good
awesome.
job.
Yes,
Good
thank
job.
you. Yeah, great.